Have you ever noticed small, tender lumps on your neck under your jaw or in your armpits when you're sick? Maybe after a sore throat or a skin infection. These lumps are often swollen lymph nodes. Now, what if they stay swollen for weeks or even months? That could be a sign of chronic lymphadenitis. Unlike the usual temporary swelling that goes away when you feel better, chronic lymphadenitis means your lymph nodes stay inflamed for a long time, more than 4 to 6 weeks. Think of your lymph nodes like security guards in your body. They catch germs and fight infections. But when they're constantly on duty, without rest, they can get overworked and stay swollen. So if you've been feeling fine, but still have lumps, it's worth checking, because your body might be sending you a quiet signal. What's causing those little swollen guards to stay on alert? Chronic lymphadenitis usually happens because the body is fighting a long-lasting infection or something that keeps coming back. Common causes include tuberculosis (TB), especially in areas where it's common, or infections like cat scratch disease from a scratch that seemed minor, but led to long-term swelling. Sometimes autoimmune diseases like lupus or rheumatoid arthritis trick the body into attacking itself, making lymph nodes stay inflamed. Even some medicines or rare cancers like lymphoma can cause this. Imagine leaving your phone charger plugged in all day, even when the phone is full. Eventually, it stresses the system. Similarly, if your immune system is plugged in too long, the lymph nodes, the security hubs, stay swollen. So the cause isn't always simple, it needs careful detective work. How do you know if it's chronic and not just a passing cold? The main sign is swollen lymph nodes that don't go away. They're usually small, less than 2 centimeters, soft or rubbery, and not painful. You might feel them when touching your neck, groin, or underarms. They stay for weeks. Other clues: mild fever that comes and goes, night sweats like waking up soaked, unexplained weight loss, or just feeling tired all the time. Picture this: you had a small cut on your hand, it healed, but the gland in your armpit stayed swollen, no pain, just there. Or maybe after a dental issue, your jaw node never shrank back. If it's been over a month and the lump remains, that's a red flag. It might not scream danger, but it whispers, "Check me." How do doctors figure out what is going on? First, they ask questions. How long has the swelling been there? Any fevers, weight loss, or infections lately? Then they feel the lumps. Are they hard, movable, painful? Next, tests. Blood tests check for signs of infection or immune issues. An ultrasound can show what the gland looks like inside. Sometimes, a small needle is used to take cells from the node, called a fine needle aspiration, to check for bacteria, TB, or cancer. In some cases, a small piece of the node is removed, biopsy. Treatment depends on the cause. If it is TB, you will take antibiotics for months. If it is from an autoimmune problem, anti-inflammatory meds help calm the immune system. Imagine your car making a strange noise. First, the mechanic listens, then runs tests. Same idea. No one-size-fits-all fix. It is tailored to your story. Can you stop it before it starts? Well, you can't prevent every illness, but you can reduce risks. Avoid infections. Wash hands often, especially after touching animals, like after playing with a cat. Wash any scratches. Treat infections early. A sore throat or skin infection should not be ignored. If you live in or travel to areas with TB, get screened. Stay up to date with vaccines, like BCG and high-risk zones. And if you have an autoimmune condition, follow your doctor's advice to keep it under control. Think of it like car maintenance. Regular checkups prevent big breakdowns. A little care today can keep your body's security system, lymph nodes, calm and functional. What's new in the world of chronic lymphadenitis? Scientists are using better imaging, like PET scans combined with CT, to see inflamed nodes more clearly. New molecular tests can quickly identify hidden germs, like TB or unusual bacteria, from tiny tissue samples. Some studies are exploring how the body's immune signals, like certain proteins, can help diagnose the cause without needing a biopsy. Imagine using a super-powered flashlight to see tiny germs, or reading your body's text messages to know what's wrong. Also, researchers are studying how gut health and chronic inflammation are connected to lymph node issues. It's not magic, it's science making diagnosis faster, less invasive, and more accurate.